Good afternoon, everyone. My name is Kai Kaufman. I'm a volunteer with the Indigenous Physical Activity and Cultural Circle. And today I'll be introducing Débora Petry Moecke. She'll be presenting her poster titled Scoping Review on Telehealth Use by Indigenous Populations from Australia, Canada, New Zealand, and the United States. So please join me in welcoming Débora.
My name is Débora Petry Moecke, and I would like to start this presentation by acknowledging that we are gathered today in the traditional ancestor and unceded territories of the Nanaimang Nation. I'm sorry, I have to write it down. Just not all right, so I recognize that the poster is going to be like letters are small, so if you want to come a little bit close to me, then we will be able to see better. But if not, I'll try my best just to speak about the poster today. Thank you very much. All right, so as I mentioned, my name is Débora, and I'm supervised by Dr. Petry here. I'm actually from Brazil, but I've been living in Vancouver for the past 2 years, and I'm doing my PhD in the Rehabilitation Sciences program. And so this work that I will present to you today is scope review on Indigenous populations use of telehealth and the populations from Australia, Canada, New Zealand, and the United States. And this work was conducted in partnership with the Careers Dependent Family Services. So what's telehealth? Telehealth is the use of technology to provide healthcare services over a distance. And telehealth has been suggested to address some specific needs of indigenous populations due to its potential to increase access to care, to be cost effective, and to facilitate the provision of culturally safe care. There are previous studies exploring the use of telehealth by indigenous populations, and overall the evidence available support its effectiveness. However, these studies, they often focus on specific age groups, for instance, elders, or they focus on specific types of technology, or even in specific diseases or health conditions. So no available studies actually reported broadly on the characteristics of the telehealth used by indigenous populations. So that's the aim of our scoping review. And in addition, we have some sub-questions that we're interested in. So these sub-questions are key concepts on functional safety, effective use, and building therapeutic relationships. So for our methods here, we follow the recommendations by the Joanna Briggs Institute. This is an institute from Australia, and they provide guidelines for conducting this type of research. So here in this figure 1 here, we have a personal flow chart with like the process that we use to gather the papers that became part of this scoping review. So initially here in the first box, we have 17 different databases that were searched. And then at the end of the screening process, we ended up including into this review 231 papers. These papers all focused on telehealth used by indigenous communities, or had at least 50% of indigenous people included. They all were from one of the 4 pre-established countries that I mentioned. And the reason why we selected these 4 countries is because of the similarities in organization processes. And they also all had to be written in English and published between 2000 and 2022. So jumping into the next column here, the results, which is the most interesting part. The figure 2 here shows a timeline of publications per year. So we have the number of papers published per year in each one of the 4 countries. And we can see here that actually 82% of the papers were published in the past decade. So really from 2012 to 2022. And then within the last 5 years, approximately 2/3 of the papers were published. And interestingly, here we can see that in 2020, there was an significant increase in the number of publications in telehealth used by indigenous populations, and we believe this is likely due to the COVID-19 pandemic. But what this graphic really shows is that this is a growing field of research, telehealth used by indigenous populations. So with respect to the location or where these papers came from, of course, it's one of the 4 countries, but the majority of, or the biggest proportion of papers that came from the United States, followed by Australia, then Canada, and then New Zealand. But if you consider the actual population size of these countries, more specifically the indigenous population size of these countries, we'll see that actually the biggest contribution came from Australia and New Zealand. Then, with respect to the design that is applied, quantitative research methods were the most commonly applied. And then, with respect to the geographical location, more than half of the studies were conducted in rural locations. Now, this figure 3 here, it's another graphic that actually complements the first one. So this shows the proportion of studies that reported on Indigenous involvement. What's Indigenous involvement? What this stands for? So Indigenous involvement is whether the authors of these studies, they explicitly reported engaging with Indigenous communities when developing and implementing their telehealth services. Okay, and so strikingly, only 60% of the studies explicitly reported having Indigenous involvement in their research studies and in their telehealth services development and implementation. However, what this red line here shows is that this is actually increasing over time. So more recent publications, they are reporting more on Indigenous involvement. Now, table 1 here shows the Indigenous groups and how they were identified in the papers. So, of course, this is something that varies according to the country where the study was published. But while some authors use terms such as Indigenous and Aboriginal, we were still able to identify 11 different Indigenous groups within this body of research. They're all listed here in this table. And why this is important? Because these are the groups that are more likely to benefit from our research findings. Right? And then moving on to the third column here, figure 4 shows the different types of technology that have been used in this different studies that were included. So first we can see that mobile health or mHealth, which included mobile applications, apps, or text messages, this is by far the most commonly utilized type of technology, followed by video conferencing or video calls, followed by web-based interventions. So this can include websites and also social media platforms. And then store and forward. Store and forward means that someone will collect the data locally. So for instance, a nurse will collect the data in the community. So this data will then be transferred for an intermediary place. And then after that, it will be forwarded to the specialists, often the specialists, right? And then the other ones were less commonly applied, but we still have remote monitoring, TV, CD, radio, video, electronic medical record, and accelerometers that is more advanced than bits. Then moving on to figure 5, here we have the health focus of the telehealth interventions. So we were able to identify a wide variety of health conditions that being addressed by telehealth. Actually, to be more precise, 38 different types of health conditions. And that's why the percentages here, they're not representative, but they were spread out among these different types of health conditions. But we still can see here in this figure that mental health has been receiving special attention, right, by telehealth. So the majority of the studies were targeting mental health issues, followed by diabetes and diabetic retinopathy. And then the other ones that were not that represented. Now, switching gears a little bit to talk about the sub-questions that I mentioned we have. So first we characterize and map and characterize all the telehealth used by Indigenous communities in these 4 countries, and then we came up with our sub-questions. And one of them is related to the key concepts on cultural safety. So how to achieve cultural safety in telehealth interventions. And so the first thing, or the most important thing, the most important way to achieve cultural safety in telehealth is by community engagement. So really having community advisory boards, building relationships with the communities, or community members. This is crucial in order to achieve cultural safety in telehealth services. The second thing was tailoring telehealth to the targeted Indigenous group. So what is meant is, for instance, using colors, imagery, graphics, icons, and even content that is relevant to that specific Indigenous community that you are targeting, right? So this could be added, for instance, into mobile applications, into social media platforms or pages, or into websites. This is really important. And then the third thing here was respect indigenous cultural values. And this is a broad category, I acknowledge that. But what it means is, for instance, incorporating cross-cultural conceptualizations of health and wellness. So including a more holistic approach to health. For instance, including language, ceremony, traditional healing practices, whenever possible, into telehealth services. And then the other ones, again, they're listed here, but they are not that significant, so we can discuss about it later if someone is interested. And then figure 7 responds another section, which was related to the key concepts for building therapeutic relationships. What's therapeutic relationship after all? So therapeutic relationship is the relationship between the patient and the healthcare provider. And 64 studies that were included in our review talk to some extent about the therapeutic relationships. This represents 28% of the studies in our review. Among these 28%, 38% talked about telehealth as having a positive impact on the relationship between patient and healthcare providers. They talk about, they show that it actually increased the continuity and the consistency of the therapeutic relationships. And this was for several different reasons, but just to name a few, I have listed a couple of them here, but probably you can see. So the first thing is, for instance, increasing the frequency of contact between the healthcare provider and the patient. This gives a sense of connectivity, staying connected with the healthcare provider, being able to reach out to the healthcare provider you want and with more access more easily, right? Or even one thing that I found really interesting, some studies talked about how the physical distance between healthcare provider and patient in telehealth actually facilitated the disclosure of sensitive matters, because they were not face to face, it was easier for them to talk about some topics, sensitive topics. On the other hand, 39% of the papers talked about telehealth as having a negative impact on the relationship between patient and healthcare provider. They really show a preference, a strong preference for face-to-face interactions or in-person consultations. And why is that? Again, different reasons, but just to name a few. Overall, feeling uncomfortable. So some people, they just feel uncomfortable, right? Talking to the health provider over screen, in a video conferencing. Another thing is the fact that sometimes the session becomes more about the technology itself than the actual engagement. So people spend more time talking about like how to set up technology and troubleshoot in case there's like issues of internet connectivity or whatever, and they forget about the actual more important thing, that's the engagement. So yeah, the different points of view with respect to the therapeutic relationship. And then moving on to the last part of our findings. Here on table 3, we have the barriers and facilitators for telehealth effective use. So we came up with this extensive list, but I won't talk about all of them, of course. But the main 3 barriers that we identified were concerns about privacy and confidentiality. So this was the main barrier, actually, to effectively using telehealth. The second one, limited access to the required infrastructure, so to a good and reliable internet connection. And in the third place, low health and digital literacy. So this refers to the lack of skills and comfort level using technology for healthcare purposes. And then on the other side, we have the facilitators. So what were the 3 main facilitators for telehealth use, effective use? So the first one was cultural relevance and appropriateness. So we talked about this already. So really targeting, thinking about the social and cultural context of the community. Second thing, community engagement. So again, as we also discussed already, the main thing to achieve cultural safety in telehealth is community engagement. And so it showed that again in the list of facilitators. And the third thing was convenience. So really, for instance, not having travel requirements, being able to stay in the community, to stay within the safe environment of the community, being able to stay connected with the land and with the cultural and social support network systems. This is something that was really valuable and was considered to be a facilitator of telehealth use. So in conclusion, this was a comprehensive review that identified several critical factors that can be used and should be used to guide the development of telehealth services for Indigenous populations. And we hope that with this, we'll be able to help achieve more equitable access to healthcare services and improve health outcomes of Indigenous people. And next steps moving forward, we are continue working with CSFS, the Commercial Component Services, to develop best practice guidelines for healthcare providers working using telehealth in their healthcare service provision to again just help achieve better health for everyone and more accessible health. So that's all. Thank you so much. If you have any questions about
and we really encourage everyone to find Débora and ask questions, start conversations about what this is really interesting. Thank you so much for your presentation today.
Thank you.
How can we do it for our own people, at least for this? Because I don't think they have that.
Yeah, so yeah, I know each community will have like really individual way of like providing healthcare services. What the reality that I know is the communities that are served by CSFS, like our partners in Northern BC, and they all have a system in place. But I think that's definitely something to be further discussed if it's of interest of the community to implement this kind of service. That's definitely something to just bring to the table and say, oh, that's something that's happening in different communities and it's working. So perhaps that's something we could implement in our community as well. So I think just bringing forward these discussions is potentially something that could help developing services in different communities that don't have it now.
Thank you so much.